Welcome to the Deep Dive. Today we're tackling a really compelling area, how the smart use of data is starting to revolutionize healthcare. Specifically, access and quality for communities that, well, have often been left behind.
That's right. And our focus today is squarely on the Institute for Life Sciences Collaboration, or ILSC, and their really innovative partnership with Lynx-IQ.
Yeah, and our mission here really is to unpack how their whole data-driven approach aims to kind of connect the dots in what's usually a pretty fragmented health ecosystem.
Exactly. It's all about putting powerful health insights, information back into the hands of individuals and communities, empowering them.
Okay, let's unpack ILSC itself first. Formed back in 2012, right? A nonprofit.
Correct. A 501c3 organization. And their mission is very specific, taking promising life science ideas and actually turning them into health programs that are accessible, affordable, especially in the global south.
And the interesting bit is their focus isn't more on the humanitarian collaboration side, getting solutions out there, rather than just, say, basic research.
Absolutely. It's about translation into real-world impact. And right now, their focus is, well, very targeted. For 2025, they're really honing in on early detection of kidney problems.
Kidney problems linked to what specifically?
Primarily linked to sickle cell disease and preeclampsia, and also supporting actual sickle cell disease treatment itself. That's a big push for 2025.
And this ties into bigger global goals too, doesn't it?
It does, very strongly. They align their work with the UN Sustainable Development Goals, specifically, number 3 for good health, number 4 for quality education, and number 17, which is all about global partnership. That's sort of the framework.
Got it. And this is where Lynx-IQ comes into the picture, with the tech side.
Precisely. ILSC teamed up with Lynx-IQ to build this patient-centered health tracking application. The core idea is simple but powerful. Monitor and share information that often gets missed.
Like what kind of information?
Things like, subtle changes in symptoms, how well people are actually sticking to their treatments, and even results from new kinds of urine self-tests they're developing.
And the real engine behind all this is data, right? That's the focus.
Absolutely. That's the key takeaway we'll keep coming back to. Leveraging data. The goal is to get vital information, not just to the patients themselves, but also to their doctors, the companies making the tests, even public health leaders. It's about connecting everyone.
Connecting these, currently disconnected pieces of the health system.
That's the vision, using data as the bridge.
So let's get down to the core problem they're tackling. It sounds like a big part of it, especially in places like the global south, is just a lack of good healthcare data.
That's a huge issue. In many regions, data collection is patchy, inconsistent, or sometimes just non-existent. And without that data, well, making accurate diagnoses is tough.
And planning healthcare for a whole region must be incredibly difficult.
Exactly. You're kind of flying blind. ILSC's solution, particularly this 2025 initiative focusing on early kidney damage in sickle cell patients, is designed to start, shedding some light.
Filling in those blanks.
Right. And data mining techniques are part of that solution, aren't they? Even if you don't have perfect data, you can still pull out insights.
Absolutely. Even with limited data sets, data mining tools can help extract valuable patterns, find correlations, things that can really improve how healthcare is delivered. It's about making the most of what you do have.
Getting smarter with the information available.
Okay, so let's dive into the specifics then. ILSC and Lynx-IQ's data-driven solution. The 2025 initiative. It centers on a test, right?
Yes, a dipstick test, technically a lateral flow test. It's designed for early detection of kidney damage in people with sickle cell disease. This isn't out of the blue either. It builds on ILSC's research from 2022 that showed, yes, you can detect these early protein markers.
So the science is there, but the innovation is how they're using the test. It's more than just diagnosis.
Exactly. That's the really clever part. This dipstick isn't just a one-off test. It's designed to be a conduit for data collection, a continuous stream of information.
How does that work? How does a simple dipstick become a data tool?
Okay, so each dipstick has a unique QR tag printed right on it.
Oh.
So either the person taking the test or maybe a clinician can just scan that QR code with a smartphone app. It'll be on both Apple and Android, and boom, the result gets logged.
That is smart. So simple, but it creates a digital record instantly. And patients can do more with the app too.
Yes, definitely. Patients can choose to create their own secure accounts. This lets them store their results, track them over time, see trends, but it's not just about the numbers.
Yeah.
They can also access educational materials about their condition, about kidney health, right there in the app, and it can help connect them with local healthcare providers too. It puts more control and information in their hands.
That sense of agency must be huge.
Mm-hmm.
But what about places where internet access is spotty? That's a common issue,
A
right?
massive issue, and they've thought about that. The Lynx-IQ app is built using an offline-first design philosophy,
Meaning,
meaning you can still enter and save test results, notes, whatever, even if your phone has no signal. The data is stored securely on the device. As soon as you get back online, even briefly, the app automatically syncs all that stored data up to the secure platform. So no data gets lost just because of bad connectivity.
that is absolutely crucial for the communities they're aiming to serve. That offline capability is a real game changer, isn't it? Addressing that infrastructure barrier head on.
Definitely. It ensures that valuable health information isn't lost.
Okay, so we see how the data is collected. Let's really dig into the why. How does this data actually empower all the different people involved? Let's start with the patients, the individuals.
Right. For patients, it's huge. First, they get really important, understandable information about their own kidney health status. Early detection means awareness. It means they know sooner if there might be an issue.
Which allows for earlier action, presumably.
Exactly. That knowledge can help guide conversations with their doctors, inform treatment decisions, and hopefully lead to much better health outcomes down the line. Plus, tracking results over time.
They can see if things are improving or getting worse.
Precisely. They can monitor their own disease progression, see how well treatment is working. It gives them a clearer picture and, as you said, more agency in their own care.
That empowerment, just having the information, seems fundamental.
Right.
Okay, what about the healthcare providers? The doctors, the nurses on the ground?
For providers, this offers almost like an on-site confirmation. If a test flags a potential issue, they know right away. This can trigger preventative measures before someone develops severe symptoms.
So moving from reactive to proactive care.
That's the goal. It also opens the door for better conversations about, say, targeted health education or specific wellness paths for that patient. Knowing the data helps tailor the advice.
And gives them insight for planning future care.
Yes, it helps them anticipate what a patient might need down the road. And the platform itself, the collected data over time, becomes a really valuable tool for managing that patient's care long term. It's not just a snapshot, it's a movie.
A much richer picture than occasional clinic visits alone could provide. Okay, shifting gears. What about the company making these dipsticks? What's in it for them?
Good question. For the manufacturer, this data provides invaluable real-world feedback. First, it confirms that the tests are actually being used and where.
Okay.
But more importantly, it lets them evaluate their initial design, their quality control and manufacturing. Are the tests performing as expected out in diverse real-world conditions?
So it's a quality assurance loop.
Exactly. It helps them understand test performance deeply, which feeds back into continuous quality improvements, maybe optimizing protocols, and crucially, identifying any potential issues with a batch or the design very quickly.
Makes sense. Faster response if something's not right.
Yeah.
And finally, the big picture view.
Mm-hmm.
The country health leaders, the financial decision makers. How does this data help them?
At that macro level, the aggregated, anonymized data is incredibly powerful. It can directly inform public health policy. It allows for realistic economic cost analyses. What's the actual burden of kidney disease related to SCD in our population?
Which helps with budgeting and resource allocation.
Absolutely. It guides future budget decisions. It can help ensure a stable supply chain for the tests themselves, improve communication across the health system. Ultimately, it provides hard evidence for the cost effectiveness of early detection.
And highlights where more support or research might be needed.
Precisely. It identifies gaps and needs within communities.
It's really striking how collecting data at the individual test level ripples outwards to impact the entire system. So let's get more granular now on the types of data being collected. Each piece tells a different part of the story, right?
Exactly. Each type serves a distinct purpose. So first, there's the initial data you get when the test is first rolled out.
What does that tell you?
That baseline data is crucial. It establishes the immediate impact. Are people using it? What are the initial findings? It also helps identify any early challenges, things that might affect the test's accuracy in that specific environment right from the start.
Sort of setting the stage. What comes next?
Then you have demographic data. This is really important for context. Linking the health data, the test results, with things like age, gender, location, maybe even socioeconomic factors where ethically possible.
Why is that context so important?
Because it connects the dots between health outcomes and the social determinants of health. It helps ensure interventions are appropriate for specific communities, timely and culturally sensitive. You see the person behind the data point.
Right, not just a number. And then the core clinical stuff.
Yes, the clinical data itself. Analyzing the actual test results helps confirm, okay, is this test effectively detecting early kidney damage across different groups? Are there factors, maybe other health conditions, that influence the results? It validates the tool.
And the results themselves, are they just yes, no?
No, the test results include both qualitative, like is the marker present, and quantitative aspects, potentially indicating the level. This richness is vital for ensuring accuracy and guiding the next steps in treatment.
And you mentioned tracking over time earlier, that longitudinal aspect.
Hugely important. That's the time to detection data, or longitudinal data. Following individuals over months or years lets you quantify the real impact of catching kidney issues early.
How so?
It provides insights into how well early treatments are working. Does intervening sooner actually change the disease's trajectory? It helps understand disease progression in a way snapshots can't.
Makes sense. And finally, the cost aspect again.
Yes, collecting cost data. This is about understanding the economic value proposition of this relatively simple dipstick test. What does it cost to implement? What are the potential savings downstream from early detection?
Which helps communities plan.
Exactly. It helps them budget for healthcare costs more effectively and assess the financial risks associated with these health conditions at both a local micro level and a national macroeconomic level.
So ILSC's role here is clearly more than just handing out tests. Our sources use the term conduit.
Yeah.
What does that really capture about their approach?
I think conduit is a good word. It means they're not just providing the tool, the diagnostic, but aiming to create a whole pathway, an end-to-end approach, especially in these underserved areas that might lack robust health infrastructure.
Thinking beyond the test itself.
Right. How does the data from that test connect to the next step? To education, to care, to policy. They want to facilitate that flow.
And the open technology platform is key to being that conduit, I gather. What's the big idea there?
The vision is ambitious, but necessary. They want to build a platform that doesn't exist in a silo. It needs to be able to connect smoothly with other health solutions, both current ones and ones that might emerge later. Interoperability is the key word.
Meaning other healthcare providers or systems can plug into it.
Exactly. Clinicians, hospitals, even companies providing specific therapies or treatments should eventually be able to integrate with this platform. This allows for much better care coordination, a more holistic view of the patient.
And it's not just for direct care providers, public health agencies too.
Yes, that's a crucial part. Government health departments, public health agencies, they can use the anonymized, aggregated data from the platform.
For what purpose?
For developing public health strategies, making evidence-based policy decisions, allocating resources more effectively. Think about planning vaccination campaigns or targeting health. Exactly. Data sharing and privacy. This is a balancing act. You want the data to be accessible for improving health, but you absolutely have to protect individual privacy and data security, adhering to strict global standards. That trust is paramount.
A complex but critical balance. How do they plan to actually make this happen on the ground? It sounds like a big undertaking.
It is. And they know they can't do it alone. Strong partnerships are central to their strategy. They plan to collaborate widely with global organizations, local community groups, private companies, governments, universities, other nonprofits, a whole network.
And technically, how will systems connect?
The plan is to use APIs, application programming interfaces. These are like standard plugs that allow different software systems to talk to each other smoothly.
And they'll test this out first.
Yes, they're planning targeted pilot programs in specific communities. This lets them test the whole operational model, refine the technology, figure out what works best in different contexts before scaling up, learn by doing.
Now let's connect this data collection idea to tangible economic impact. We have this interesting study from Ghana, supported by ILSC, looking at the economic burden of sickle cell disease. What did that find?
Right. That study provides really compelling context for why this work matters financially. It aimed to quantify the economic hit that SCD has on households in Ghana.
How did they do that?
They used a quantitative approach, collecting data from 2018 onwards and even projecting out to 2028. They looked at things like, obviously, sickle cell status, but also gender, age, location, household income, inflation, and how these affected healthcare costs.
Both direct costs like hospital bills and indirect costs.
Yes, exactly. Direct costs like medicines and visits, and indirect costs like lost wages due to illness or caregiving.
And the findings were pretty stark, weren't they? especially concerning income levels.
Very stark. It found that the generally low average household income in Ghana makes it incredibly difficult for families to manage the costs of caring for someone with SCD, and high inflation just makes that
The
worse.
double whammy.
Pretty much. And crucially, the study confirmed that households with an SCD patient face significantly higher direct and indirect costs compared to households without. No surprise, perhaps, but quantifying it is important.
But there was a positive note about early detection.
Yes, that was a key insight. Early detection gives families time. Time to understand the potential future costs and maybe start planning financially for the long haul of treatment and care. It empowers them to prepare.
Knowledge is power, even financially. Did the statistical analysis pinpoint specific drivers of these higher costs?
It did. The regression analysis showed that several factors significantly increased healthcare costs for SCD households in Ghana, having SCD itself, obviously, but also the patient being male, their age, living in an urban area, having a slightly higher income, likely meaning accessing more care, and higher inflation rates all pushed costs up.
And they put a number on the difference.
Yes, the model suggested that, holding other factors equal, a household with SCD likely faces about 20% higher direct healthcare costs.
20%, that's substantial.
It is, and about 1.5% higher indirect costs based on their model. It really quantifies the economic strain SCD places on families, and by extension, the health system.
And this ties directly back to ILSC's work, doesn't it? This kind of economic data underlines why collecting health data through their platform is so vital.
Absolutely. Understanding this economic burden makes the case for early detection even stronger. It allows for cost-effectiveness analysis of interventions like the dipstick test and helps governments and communities plan budgets knowing the true costs involved.
It connects directly to those UN goals, again, good health, global partnerships, by providing that crucial, timely data.
Exactly. It provides the evidence needed to advocate for resources and build those partnerships effectively.
There's another piece of research we should touch on from The Lancet, which paints an even broader and frankly quite concerning picture about sickle cell disease mortality.
Yes, that Lancet article from June 2023 looked at the global burden of SCD, and one of its most shocking findings was about mortality. It found the total number of deaths linked to SCD is likely almost 11 times higher than what traditional estimates show.
11 times. How can that be?
Because traditional estimates often only count deaths where SCD is listed as the direct cause. This study looked at the overall excess mortality in people with SCD, capturing deaths from complications or related conditions that might not have SCD listed on the death certificate. It's a hidden burden.
Wow. And that has implications for children, too.
Huge implications. For children under 5 globally, this study ranked total SCD-related mortality as the 12th leading cause of death in 2021. But if you only look at deaths directly caused by SCD, it ranks way down at 40th.
So we've been drastically underestimating its impact on child mortality.
Significantly. And the study authors argue that this has major implications for meeting those UN Sustainable Development Goals related to reducing child mortality and premature death. You can't hit those targets if you don't accurately understand and address a major contributor like SCD.
Which brings us right back to the need for better data collection, doesn't it?
Precisely. The Lancet study explicitly calls for routine, sustained surveillance efforts. The kind of data ILSC and Lynx-IQ are aiming to collect real-world longitudinal data is exactly what's needed to uncover this true burden and guide effective public health strategies. You can't fix what you don't measure accurately.
So wrapping this up, it seems really clear that this partnership between ILSC and Lynx-IQ is, well, genuinely innovative. They're leveraging data in a really smart way to try and connect the pieces of a health ecosystem that's often disjointed, especially for conditions like sickle cell disease in places that need it most.
Absolutely. It's a data-centric approach, and that's the power. It empowers patients with information, it gives providers better tools and insights, and it equips public health leaders with the evidence they need for smarter decisions. Early detection, better care, efficient resource allocation data underpins all of that.
And as that Ghana study showed so vividly, it's not just about individual health, though that's paramount. It's also about tackling the very real economic burdens these conditions impose, which helps make the case for broader public health investment.
Indeed. Demonstrating that economic impact through solid data strengthens the argument for platforms like this, making healthcare more sustainable and equitable in the long run.
So for you listening, just take a moment to consider the potential here. What looks like simple data collection, a QR code on a dipstick, an app when it's applied strategically, thoughtfully.
Yeah.
It can be transformative. It can build bridges in healthcare.
It moves beyond just treating individuals to impacting whole communities, strengthening health systems from the ground up.
Exactly. So maybe think about other areas in healthcare, perhaps ones you're familiar with. Where else do you see gaps? Where could this kind of careful, connected, data-driven approach make a real difference in creating more equitable and effective solutions? It's definitely something worth pondering. Thanks for joining us for this deep dive.